treating minor cuts and grazes, the damaged body part should be raised above the heart. If you don't have a sterile dressing, use a hand, tea towel, or t-shirt. Those who are treating a wound should wash their hands and use gloves. Home care for minor cuts. You can stop bleeding by applying pressure with a gauze pad or clean cloth. The cut should be thoroughly rinsed with cool water after the bleeding has stopped. Hydrogen peroxide and iodine peroxide can damage living cells and should not be used on wounds directly. When you want to remove glass, gravel, or other foreign material, use a tweezer cleaned with rubbing alcohol. Apply pressure. It is the best way to stop a bleeding wound by applying pressure to the wound. Place a clean and dry material such as a bandage, towel, or cloth on the wound. Keep a constant pressure until bleeding stops. Stop the bleeding. Mild bleeding usually stops on its own or slows down to an ooze. If you have an injured person, lie down and raise the bleeding area. Remove any visible objects that are easy to remove from the wound. Raise the affected area. If the injury is to the hand or arm, raise it above the head. If it is to a lower limb, lie down and raise the affected area above the heart. It is supposed to stop the bleeding of the blood. If you apply ice to a wound, you will constrict the blood vessels and allow more of a clot to form. You can wrap the ice in a clean, dry cloth and apply it to the wound, preventing infection. It's important to keep the wound clean when bleeding stops. Rinse the wound with cold water and wash the surrounding area with soap. Use a tweezer if possible to remove dirt or debris from the wound. When to see a doctor. Most minor bleeding can be prevented at home using simple home remedies. It is important to cover minor wounds with a bandage to prevent infection. The #1 preventable cause of death in trauma is the bleeding. Mouthwash. The alcohol in the liquid acts as an antiseptic. It is possible to treat blemishes in the mouth with an amicor substance. Before you try to stop the bleeding, be sure to wear medical gloves if you have one before applying direct pressure. Use cloth, plastic bags, or the cleanest material. Have the injured person, if possible, hold direct pressure on the wound. Petroleum jelly. Many cosmetic products contain petroleum jelly. This product contains a mix of oils and waxes. Homemade remedies can also stop bleeding. Antiperspirant. Antiperspirants can constrict blood vessels to help clot a wound. Aluminum chloride in a 2015 study was shown to be a fast and effective way to control minor external bleeding. How to stop a nosebleed. How do you stop a nosebleed? Stand upright and lean forward. Try to catch blood with a tissue or a damp washcloth. Blow your nose or rub it. When should I go to the emergency room if I have a nosebleed? If you can't stop the bleeding after a few minutes, you should call your healthcare provider. You vomited because you had difficulty breathing, the bleeding is rapid, or the blood loss is large. Can you die from a nosebleed? 4 out of every million deaths in the United States are caused by nosebleeds. Nosebleeds that occur higher on the septum or deeper in the nose may be harder to control than others. What is epistaxis? A nosebleed is a loss of blood from the tissue inside the nose. It only affects one nostril. They are usually not serious. Who gets epistaxis? Children are more prone to nosebleeds because of dry air, colds, allergies, and sticking fingers into their noses. Older adults may take longer for blood to clot. Anyone can get sick. Most people will have at least one case in their lifetime. Thank you for watching. Do subscribe, like, and share.